one of the practices of naturopathic medicine is to be a teacher to your patients, and I take that very seriously, and that's what I have a lot of passion for, is teaching my patients how to do the things so that they can support the self-healing mechanism, so that they can live the best life that they can live, regardless of their challenges. And I write about that. I also think about that in my approach to prescribing remedies or whatever I decide to do with the patient. When a person comes to see me for a problem they're having, that's kind of the doorway to, to a whole process with me that isn't just about what they came to see me about usually. It's just the opening. And I'm very much like an allopathic medical doctor when I do my intake with a person. I ask a lot of questions. I spend about an hour with a person, sometimes more. And it's a pretty familiar medical intake process with them. Sometimes I do lab testing, sometimes I don't. And but the approach that I have when I'm asking all my questions is that I'm trying to figure out, well, how did they get to this point? What put them here in terms of their history or their exposures or their food choices, their lifestyle choices, and that's what I'm trying to arrive at as I work with somebody in my line of questioning. So it's like being a little bit of a detective. You have to try to kind of pull out this information that maybe the person doesn't even realize it is significant in their process with me. So it's not. I was working with somebody recently. I asked him if he'd had any trauma to his back, and he said no, not at all. And then about half an hour later, he told me he broke it, like 13 years ago. So you have to kind of keep going and asking questions in different lights, in a sense, and approaching it in different ways. Sometimes people forget something that happened to them because they're totally over it, and it's not something that's in their consciousness or even maybe subconsciousness anymore, because they've cleared it from their system. And that you'll see when a person comes in and they've been with me for a couple of months and a symptom has something they complained about when they came in, and I'll say, so how's it going with that? And they're saying, oh, that's fine. And I'll say, well, 2 months ago this was a huge problem for you, and you have to remind people about their milestones and say, wow, that's great, you couldn't sleep well and now you're sleeping like a baby. That's a significant progression. In order to have a healthy body, you need to bring in the good foods and get the exercise and have stress management techniques. And I think that applies to a community. We have a lot of excellent food on this island. We have the local food movement going on that's really great, and people are loving that. We have our farmers markets. We have a community that's really, at least in the time I've been here, is really growing in that aspect. And then we have a whole network of healthcare professionals who, let's face it, if you decide to live on an island, you obviously like isolation. Who would choose to live on an island unless they had some degree of interest in that? And so all of us as healthcare professionals probably face some degree of feeling isolated. And we all go and do our continuing ed off island and stuff like that. But having connections to each other, I think, is vital to keeping us engaged in being in our community. We run into each other in public or at events, and there's a bond, that we all have because we're in this work, and we might share patients, and we might have, similar interests. but it's a connection, and I really like that whole, you know, just that engaging in that and fostering that between us, which is why I'm on the whole Health Alliance board and why I like doing this kind of work. Because we do need to keep connected to each other. And through that, we're able to better serve our clients, our patients, our public.